think we're here today to try and inform as many veterans as we can. We're here with Dr. Bash. I am Skip Burns. I'm going to ask him as many questions as I can. I'm a veteran myself, and I have so many people ask me, where do you find the information? Well, so I'm going to introduce Dr. Craig Bash, who is an expert at this. Where and when did you begin this game?
Well, I had my own case in 1985 or 6 with neck injury in service. And that took about 7 years for that case to process. And my physician had to write about 5-6 letters to get that to go through. In 1996 or so, the VA changed the rule and allowed outside medical opinions to come in. At that time, I was working with the Paralyzed Veterans of America, and so I started doing veteran opinions then.
Do you have a website?
Yep, website, www, of course. And then it's veterans with an S, medadvisor.com.
And can anybody just call you?
They can try and call me, but there's about 26 million veterans out there sometimes trying to get me. So oftentimes it's better to text me or send me an email. And I try and make a little phone call schedule and call them back the next day or two.
You do all of this. Do you do Social Security also?
Yes, I do. It's a different type of rules, and the benefits aren't as extensive as the veterans, but I can help with that also.
And you testify?
Yeah, I do veteran medical opinions for the VA court and for the regional offices and for these guys called DROs, which are decision review officers. So that's helpful sometimes because the veteran rater doesn't really know who the doctor is or can ask follow-up questions. So if I go in person, then that's helpful, and most docs don't do that, so it's kind of something I do as a value added for the veteran.
Do you travel to see veterans? Yes,
I can travel. You know, I have my own disability. I'm in a wheelchair, so it's hard, but in certain cases I can make my way out to places and do hearings and testify.
I understand now that there are ways that are available, like on your telephone.
Yeah, there's
call that FaceTime?
Yeah, FaceTime. Yeah.
Yeah.
Skip helps. Yeah, it's a good question about FaceTime. The FaceTime is a nice way to do video exams for veterans, and so it allows me to see them walk, do some range of motion, and I can add that to my report for the VA to provide more data for the evaluation.
In all that time, it sounds like you've done a lot of them. Do you have any idea how many claims you've covered by now?
Well, I've done about 5,000 veterans, and each veteran has 5 to 10 claims, so that's 25 to 50,000 claims.
Wow.
Over 20 years.
Are TBI veterans as well covered for benefits?
Yeah, so TBI is a traumatic brain injury, and the question you're asking about is what kind of coverage they have. So the TBI patients have a very high level of disability benefits, but oftentimes the TBI veterans don't have access to the right type of medical evaluations. Plus, by definition, the brains aren't working normally. So they can't think clearly, they can't remember how to get through the process, they don't know who to call. So, you know, probably 80% of the patients I talk to that have TBI are not covered for their benefits. So, but once they get their benefits through the VA hurdle, then they have all kinds of VA medical care available to them. But the problem is the VA processing is cumbersome. They get lost in the process.
But you help them through this process?
Yeah, I do the medical opinion part, and then I pass them off to some people who do administrative paperwork that maybe help process the claims or help them mail in the certified letters or maybe help them access stuff through the website. But the main part of this whole process is the medical opinion. Was there a linkage between what happened in service, and is there a nexus? Nexus is a big thing with VA. A nexus between what happened in service and what they have now. And that's the medical part that I do. And for a lot of that, oftentimes I end up doing extra testing. I might do an MRI scan of the brain. And oftentimes the VA doesn't want to do that or doesn't have the time to do those tests. So if I order those tests, then it's a big asset to the veteran.
Why do you go about this? Why do you do this?
Yeah, that's a good question. I ask myself that sometimes when I'm tired at night.
Yes.
So I go, there's like kind of several parts to it. One, I'm a doctor, I'm a radiologist, so I want to make sure the patient has good medical care, you have the right diagnosis, and you get the right treatment. Most veterans don't come to me for that reason because they're coming to me to try and get their benefits. So that's kind of an underlying thing that's part of my raison d'etre in my medical profession. The second reason is I had my own disability problem that I had to go through the VA for. It took 7 years, and so I know what it feels like for the veteran to be, run over by the VA system. The VA has thousands of lawyers and they have thousands of doctors, and the process is bewildering to them. So, and then there's the whole compassionate part that a lot of these veterans are street people. There's like a huge sort of compassion part that I can help them with to make sure they get the benefits that our country said they get when they go to war for us.
Yes. One of the things what is a DBQ?
DBQ stands for Disability Benefit Questionnaire. So about maybe 8 years ago, the VA started with these forms. There's about 70 forms called DBQs, and they're broken up by organ system, which from my thinking as a radiologist is great because we've studied cardiology and pulmonary. So organ system is great for the way I was trained and the way I understand medicine. So the VA has these forms, and they're just basically a summary of the patient's past medical history. It might be 20 years of history. And so you can put these forms in an administrative way so the VA can add them to the computer, and they can use them for the claims processing. But they want doctors to fill those out.